Hi, my patient is a 65-year-old male who has osteoarthritis in both knees. He experiences a lot of pain with any weight-bearing activity. He says he has difficulty with mobility, which has prevented him from completing functional tasks and decreases his independence. For this patient, water exercise can be very beneficial. It can decrease weight bearing through the joints, which will also decrease pain and improve range of motion and mobility. The buoyancy of the water offsets the gravitational force, which decreases compression through the joints. Water exercise can also increase muscular strength and improve cardiovascular endurance. This will improve overall functional mobility and provide independence for the patient. Hydrotherapy does have contraindications and precautions that need to be assessed before performing any water exercise. The contraindications are cardiac instability, confusion or impaired cognition, maceration, bleeding or an affected wound, bowel incontinence, severe epilepsy, or if the patient is suicidal. Some precautions that need to be taken into account are impaired thermal sensation, alcohol ingestion, limited strength or endurance, any medications, urinary incontinence, fear of water, respiratory problems, pregnancy, or multiple sclerosis. Before entering the pool, we want to make sure the temperature of the water is between 79 and 92 degrees. This will help dissipate heat as the patient exercises. Now that we're in the pool, I'm going to demonstrate some exercises that someone with osteoarthritis of the knee can perform. So to begin with, I'm just going to get a warm-up for them. We're going to start out with just knee kicks or with leg kicks. This is just going to improve the range of motion, get the snowmobile and their joints moving a little bit. I'll do about 15 reps for each leg. They can hold on the wall or try to balance on their own, depending on how comfortable they are. So once we do that exercise, again, get them close to the wall. They can again hold on to it or not, depending on how much support they want to use. And I'm going to get them just to perform a squat. This is going to help with muscular strength through their quads, and it helps them sort of get that proprioception through their knees as well. I'll demonstrate the squat. We'll do about 10 to 12 reps, depending on their fatigue level, in 3 sets. And as a therapist, I'm going to stand to the side, make sure that they're okay and they feel supported. Once they do 3 sets of those, I can then get them to run across the pool. This is going to help with their cardiovascular endurance. A lot of these patients don't do a whole lot of moving when they're on land because of the pain. So because we're in the pool, we can get them to move a little bit, increase their mobility, help with their functional tasks. So I'm just going to jog across the pool. So as I move across the pool, the faster I go, the more resistance I'll have. So this will not only improve my cardiovascular endurance, but it'll also improve the muscular strength as well. So that's it for the first session. I just want the patient to basically get comfortable in the pool, moving around, increase their mobility a little bit. It's going to give them that sense of independence, and there's a lot of psychological aspects that go into hydrotherapy as well. Because a lot of these patients, like I said before, aren't very independent when they're on land. So now that we get them in the pool, we get them moving, it's going to improve their psychological well-being.